Good morning or good evening or wherever you are. Good. I hope it's good for you. This is Danielle Z, MFT in the making, motivator and mental health maven. And today I would like to talk about something that is very, near and dear to my heart as somebody who is a professional that has dedicated their lives to serving people and helping people. When is the right time to ask for help? When should you see a therapist? When should you see a coach? So this is probably one of the most individual uh, decisions you will ever make. So please, number one, don't compare your life to anybody else. Your life is your own. Your journey is your own. But I will say there are some common themes with, needing coaching and therapy. So first of all, I will say, if you would like to move, if you have a specific goal you want. So for instance, I have a business, right? And this business is it's me and my coaching and soon to be therapy side. I have decided to get a business coach because this person holds me accountable. They give me strategic advice. And honestly, my life wouldn't be the same without her. I feel like when you build a business specifically, that kind of guidance is invaluable. So that's just an area of life where I seek coaching. And I'm not saying you need to get a business coach if you have a business, but it is super helpful because they make you see your blind spots. Same with life. If you feel like you have some blind spots or you really want to grow in this world, you want to improve, you want to transform into the best version of yourself, I would probably say coaching is probably a good route to go. Find somebody that you resonate with, their mission resonates with your soul, and because that person is going to push you. Because oftentimes we, unfortunately, surround ourselves with things that make us comfortable. And the thing about comfort is that we don't grow in a state of comfort. While it's great to be comfortable, of course, enjoy the roses, smell like life is hard and we need to take moments to enjoy ourselves. But when you stay in a place of comfort for too long, that's when perhaps complacency comes. That's where that survival mode comes in. That's where that autopilot I talk about comes in, where you kind of live your life on default and not with intention. And I'm not saying this happens for everybody, but it happens to a lot of people. Like that feeling of I'm just like on a hamster wheel kind of feeling. And that's not life. I just want to let you guys know that that is not life. I get it. We all need routines. I get it. We need to work as adults. You need to contribute. We all have bills to pay, houses to pay for, mortgages, kids to feed. I understand this, but it doesn't mean you have to dim yourself. It doesn't mean you have to, not be whole or sacrifice your sense of self and your core self to just do what you were conditioned to, do. And talk about conditioning. I've learned in my life with my coaching side of the business that a lot of what we learn when we're younger, we need to kind of unlearn when we're older, when we want to determine the life that we want to create. Because I want you to know, you all have the power to do this. You all have the agency to live in a full radiant way. And that's what I want for you all. So I would say, yeah, if you are trying to achieve a specific goal in your life, it could be anything, as I said, business, personal development, relational. Coaching is great. Um, then there's the therapy side, right? So therapy is a lot of processing. Both are valuable, coaching and therapy. But therapy is a lot of processing, and I say as therapists, we are change agents. What does that mean? We are agents of change, meaning we facilitate change. Therapy happens within the therapist. We are the instrument that therapy is conducted. So therapy, I will say, is a lot of processing. It's a lot of reframing. It's a lot of validating experiences, taking that experience, perhaps giving you a different perspective on it, and then processing those experiences. People come to therapy for a lot of reasons, and I will say, and I'm going to give you all, not like you need permission, but I'm going to empower you. Of course, like therapy is not an emergency room. And a lot of people, I think, treat it like that. Like, oh, I'm going through a change, something dramatic or something impactful just happened in my life. Let me go to therapy, which I support. If you are experiencing grief, if you are, going through relational issues, please seek therapy. But I think sometimes people often wait a little too late. And I think of therapy, I'm a therapist in training. I just want to make it clear, I am not licensed. Right now, I am coaching my coaching side of the business. I do want to have both, the coaching and the therapy, but I will say that I've just seen as a therapist in training, as a clinician working at my internship site, that a lot of people come when you know, they're almost at their last resort. And it's sad because I feel that therapy, at least like for me and my therapist, of course, I have had moments of, ups and downs where she's really had to help. I've really had to do the work to get back to my regulated state. But I treat therapy as maintenance. Like if you want to use the metaphor of a car, right? Therapy is my oil change. I make sure I get my oil changed. I go to therapy once a week. It's whatever works for you. And so I'm just better prepared for, God forbid, I experience a breakdown. Like, I think a lot of people aren't using therapy for maintenance. They're using therapy for, I get it. If you haven't having a breakdown, metaphor of a car again, you go get it fixed, but then people, after you get the car fixed, you still have to, you know, get the oil changed, get your tires rotated. And that's kind of what I feel when you continue therapy kind of helps you do. And of course, as I say to everybody, my job as a therapist is not to be with you forever. I want to give you the tools, the coping mechanisms, the insight, the processing so you can live and thrive on your own. But also too, there's no shame in asking for help. So this whole video is kind of like, when should you ask for help? As I said, from a coaching perspective, I would say if you have a very specific goal and a timeline, that's different. With therapy, I feel like it's definitely more reactionary, but I would say don't wait for things to be dire and for you to be in that, really, if you're in a, dealing with depression in a really dark place or dealing with anxiety, like you're high anxiety or you're having, unnatural thoughts, like if you're like your brain and your body will give you signals, listen to them. And I know it's hard because we all live very busy lives. And as I said, all of us are like, we're all activated all the time because of the system we live in. But please, please, I beg of you, if you're thinking about seeking therapy, please listen to your body. Your body will tell you. And trust me, I've been in places where I've pushed through and my body ended up telling me no. And then after that, when I was working in corporate America, I pushed through. I just kept on pushing through, and pushing through is not a strategy. And then I really had to get a lot of help. I chose to work with my therapist and also go into like an intensive outpatient program because my symptoms were so severe. I was not sleeping. My anxiety levels were through the roof, panic attacks. I'm not even gonna lie, suicidal ideation. So that's when I knew. I was like, Danielle, like the regular just talk therapy with your therapist, you need to do some deeper work. And um, not only that, but do cognitive behavioral therapy, which is called CBT, and dialectical behavioral therapy, which are both wonderful, wonderful therapies to get you out of kind of a rut. It's very mindset driven, very exercise driven, nuanced, because words matter. Just giving you a lot of psychoeducation around, just kind of getting your brain back to that homeostatic state. So, but that's kind of, and I get, as I said, this is all so individual. But please, 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 I beg of you, please listen to your bodies. I hate that sometimes when I work with people, both on the coaching and the therapy side, more on the therapy side, that they've it's almost like they waited too long. And I'm not saying they did it purposefully, but I wish I could have worked with them sooner to build up their agency and so they could manage through whatever said change. And that's a big thing too. I want to differentiate or so I feel like coaching you go into that you want to change or you want to make a transformation in your life. Therapy navigates and helps you process a change almost that's occurring to you. So as I mentioned, like death or a divorce or relational issues or just feeling a little your mental health is just, maybe gone array. So I feel like one is very like action oriented from yourself, which is coaching. The other one's a little more reactive, but I also too I want to say if you are going through a change in your life, I would suggest definitely talking to a therapist because the impact of whatever said change is going to make an impact on your brain, on your body, and having somebody there when you're amidst, I'll use another metaphor, uncharted waters is helpful. It's always easy to be in a boat in uncharted waters versus be in a lifesaver just flailing in the water. And that's what, therapists do. They help you as once again see your blind spot. That's similar to coaching, but what they really help you do is heal through your experiences and heal through it. And please know there is no shame in asking for help, and you decide when you want to seek help. Even if maybe you don't think that you need help, it's always good, I feel, to get other people's perspectives. Like it's almost like going to getting your physical, right? Like that's what I think we need to start thinking about mental health more like that. It's like everybody should get like a mental wellness check every year, probably more than every year, because the but it's kind of that, as I said, that maintenance, that making sure everything's good. And I really want to normalize that. I want to be part of a movement or whatever you want to call it that normalizes like, yeah, have your monthly therapy check just to make sure everything's like something doesn't have to be going on in your life to have therapy. Sometimes with my therapist, we just do a lot of self-reflecting and and where I want to be. And it's just nice to have somebody's objective, support. And, um, I've learned a lot in therapy. That's another thing for both, but especially in therapy, you learn a lot about yourself. And I think we live in a world that we are so self-obsessed with like our screens and posting on social media, but we don't even know ourselves. So, that's kind of my final message. Take the time to get to know yourself because you are worth meeting. I hope you have a wonderful, wonderful day, whatever you are doing today, and till next time.